We have administered 29,324 tests. We now have 3,583 positive results. Right now we have 101 pending. None of them are from the drive-through. 98 of them are from our urgent care. The number of COVID patients in the hospital here at Bryan right now totals 87. 11 of those are still hospitalized but no longer infectious. Of those that are infectious, 39 are from Lancaster County, 37 are from outside of Lancaster County. Let's see, the numbers of patients on ventilators is currently standing at 6. 3 of them are from Lancaster County, 3 are out. 2 of the patients that are no longer infectious are also on ventilators. In our ICUs, we have 9 COVID positive patients, and we have 4 additional ones that are no longer infectious. Obviously, the remainder are in progressive care or general care throughout the hospital. It's certainly an interesting election year, but regardless of who prevails, there is one certainty that is going to occur again this year. She's not here right now. She's usually manning this keyboard here, but Lori Lee from our advancement team has worked at Bryan Health for 36 years. Every 2 years, and actually for general elections and primaries, Lori coordinates an awesome service for our patients. She works with clinical leaders, patient registration, patients, and more to make sure that a hospitalization doesn't eliminate the civic opportunity for our citizens that want to vote, that didn't vote early or by mail. So this year she's coordinating ballots for a record number of patients, and I think a photo tells it best. This is Riker. Riker is voting in his first election, and he shared this photo and message with us with permission to share with you. And Riker said, "Never thought I would be in the hospital my first time voting, but nonetheless, I'm glad I got the opportunity to share my voice. Thanks." Thanks, Riker, for fulfilling your civic opportunity. We hope you get well soon, and thank you to Lori Lee. You're truly a great American, and thank you for your dedication to our patients. We are pouring the most recent allocation exclusively into our teams, predominantly for those on the front lines of the pandemic. And it's really in 3 primary ways. About 82% of that allocation is going to a pandemic or hazard pay differential for those working in the most restrictive work environments. It's isolated work. It's physically and emotionally taxing. There's going to be a little bit more on that in a minute. This will stay in effect at Bryan once this allotment of CARES Act dollars expire. We're going to be here for our staff working in those roles beyond those allocated dollars. Another 16% is going towards an increase in holiday pay. These employees have had little or no break since March. We're always a 24/7, 365-day environment, but this year we're obviously anticipating an extraordinarily challenging time and full census. So as all of you guys are trying to figure out a safe holiday, our team's doing that too, but they're going to be all hands on deck, and they've been doing it every dang day almost for the entirety of this year, so it seemed a very appropriate place to put it. There's an additional 2% of these dollars that are going to go for what we're calling PCU RN training. That's our progressive care unit RNs. We're going to continue to seek travelers to bring relief, and I know there's a lot of discussion throughout the state on that, but the cavalry's not coming. So we are implementing a training program for our progressive care RNs to become ICU nurses. It's about a 6 to 8 week training program. And without this influx of new talent, this cross-training will allow us to backfill for some of our ICU nurses that are going to experience and endure a very challenging November, December, January, and who knows how long. We are still seeking travelers. I think last week I mentioned we had around 70. We had at one time. That is our target. We're in the kind of the high 40s right now. We're continuing to seek and have had just a smidge of a success in the past couple of weeks here. So when we referenced the grueling nature of our team a few weeks ago and asked for your help, some educators in the community heard this. And we began receiving inspirational cards, handmade ones, for our team from school children throughout the community. Last Friday, members of the senior team had the privilege of distributing these to the units that are dealing with COVID patients. And I can tell you that it was an incredibly humbling and rewarding experience. There were tears, there was laughter, and a whole bunch of smiles. And what I think I learned through this is it's often the simplest things that are the most meaningful. And thank you to these kids. It was very uplifting for our team, and I think they felt good knowing some had their back. And frankly, it was encouraging to see so much expression of masking and hand washing and understanding of the circumstances by our kids. So why did this feel so important and so uplifting to them? I'm going to show you a few slides. This is the view of our Bryan East campus when our critical care nurses and those dealing with COVID patients arrive for a 12-hour shift. This is the view of those that are exiting during their 12-hour shift. Many will jump into full PAPRs for their entirety of their 12-hour shift. They'll take it off to eat, to change batteries when they need it. They're often the only people that are interacting with these patients. They give the information to distraught and scared families. They hold hands, they pray, they dispense some of the most advanced care on the planet. They're also cleaning rooms now. They're delivering foods. They're drawing blood. They're doing things that many others in the organization once were able to do to assist them. Many of them are moms and dads with school activities and social activities that are also on the mind. Some are now the sole breadwinners for the family. All of us are really struggling with this and struggling with what to do with the holidays. But just like all of us, these are the folks that every day, they don't see a data point regarding COVID. They're seeing the patients that are dealing with this and the families that are dealing with it. So as the entire organization does all that we can, this group is certainly very deserving of the allocation of these pandemic dollars, CARES Act dollars. They're some of the most highly competent, compassionate, smartest, and toughest people I know, and we can't say enough about them. So what really made them smile, and this is where I'm going to close the loop a little bit. We had all kinds of letters come in. These from Cabot really kind of, we put out on our Facebook page, and we encourage you to go look at it. Yeah, inspirational messages from the kids, and many of them also shared a joke to bring a smile to the teacher or to the caregivers. So we've produced these into signs. They're all over our campus, so our team that didn't receive a specific one personally can all share in the joy and see that some of them have their back. I'm going to end with this. Since April 3rd, it feels like Groundhog Day. We've been talking about wearing masks and washing your hands and staying distance. Well, an area fourth grader probably said it best in one of their personalized cares. Here's what their message said from this little fourth grader. Thank you for saving lives. I wish some people would learn to wear a mask so all of us can take them off forever. Let's model good behavior for our youth, and in the process, give a hand to our critical care teams and our fellow man, and you know what to do, and it's this. Please help them out.
I want to take some time today to share with you what I talked about last week in reference to our surge plan. There were a lot of questions about how complex it might be, so we tried to simplify it the best that we could. So what you see on your screen right now is 6 criteria that we utilize. So we're looking at our number of positive COVID patients in-house that are an inpatient. What is our census at midnight? What is our ICU capacity at that point in time, the designated beds? How many positive COVID patients are in our intensive care beds? And are we holding any patients inside of our emergency department waiting for a bed to free up? And of those patients, are any of them an intensive care patient? So what we do is we use a level or a point system depending on what range we're at in that given day. And I want people to know our census could fluctuate by 50 to 60 patients in any given day over just a 4 to 8 hour time period. So what we're doing is we're looking at trending. So we look over a 3-day trend, And if our point total falls between 4 to 7 for 3 consecutive days, we move into phase 1. And what phase 1 results in is us reducing our elective surgeries that require an overnight stay up to another full week. And then as we continue to monitor, if we fall between the score of an 8 to an 11, we go into phase 2, and that would be a reduction of 20% of those same type of elective type procedures or surgical cases that require an overnight length of stay. So it is looking at this trending over time. So as I spoke about that last week, it ends up that on Friday, we instituted phase 1 of this surge plan because we hit 3 consecutive nights of a level 4 to level 5. We have been in that range over the weekend and into last night. And last night we moved to a level 8. So what that means are 8 points, which puts us at the second level if we do that 2 more consecutive nights. So we want people to know this is real, folks, and the best thing that you can do is abide by those measures that we've talked about. Avoid those large crowds. Wear your mask. Social distance. Wash your hands as often as you can. I know that as we have this holiday coming up here, Thanksgiving, and I'm sure there's a lot of people tonight that are going to be watching the election together, you have to know where people have been and continue, and I know it's hard to treat family in that fashion or a really close friend, but people are moving around all throughout the day and you don't know who they've been exposed to. So it's the best way to protect yourself, the best way to protect others. So as we've talked about this now for many months, we've talked about the surge, and it's only, one large gathering away from this continuing to escalate. So we're making a plea to everyone. Please take this seriously. You're seeing it in the numbers. We talked about this back when this pandemic first started. We were the beneficiary of watching what happened in other parts of this country and the world, and we're trying to learn from that and take the necessary precautions. So it's a plea out to all of you to continue to do that so that we don't see this get out of control in our region.
Yes, we received $3,925,000. Of those allocations to date, it's about $3.3 million that has been allocated. We're holding just a bit to see where we might need to supplement some of these categories because this money has to be spent before the end of the calendar year. I just want to reiterate what we're doing for our pandemic pay. Again, regardless of more money comes from the feds or the state, it is a program we are going to keep in place for our team through the duration of the pandemic. Again, it just comes down to math. And in fact, on one of our recent pandemic calls, I do not recall if it was yesterday or Friday's call, with the number of new cases in Lancaster County, not even accounting for rural Nebraska, who we serve those patients as well. Based on the number of new cases last week, they're projecting that's going to result in 7 to 10 days in 38 more hospitalizations. So as case counts go up, there is a percentage of them that come back to needing hospitalization. Right now, most of the last decade, it's eclipsed where Bryan treats about 75% of the patients that need hospitalization in Lancaster County. And we kind of have a hospital built to operate at full capacity all along, so that means there's staffing in place. So it's really tough to compare one to the other. I know that others are at capacity, but they might have more physical capacity. They just don't have, they're not staffed the same way. But yes, it's concerning with the overall case numbers going up. That's why what that little kid said is right. We have one way to help slow the spread on this.
This is typically the time of the year that we see our census increase anyway. And there's a variety of factors in relationship to that. People are having more elective type things done towards the end of the year because of their insurance plans where they have deductibles still left. It's also getting that time of the year where we're starting to see the cold and the flu creep up. So this is typically a busy time of the year, but then when you add on the pandemic, of course, it's adding more to the volume at this organization. I will tell you, I think as the plan has continued to progress, we've adapted accordingly. Our staff are really stepping to the plate. We do have the ability to bring in some additional, we call them agency staff members, but people need to know all other 50 states are pulling at these companies to get these agency staff members in. So it's not easy to find these individuals. So what you have to do is kind of catch it from a timing perspective. A lot of them work 13-week assignments. So if you can catch an individual that may have been here in the past that loved their experience here at Bryan, we can pull them back here to help us out during this period of time.